So when they do test clinical judgment, they use this 6-step clinical judgment measurement model. And this is basically just the 6 questions in a case study. And so you might not be familiar with this, but you've probably seen the nursing process before, ADPI, and this is really similar. So we assess or figure out which of these cues is most important. We diagnose or analyze what could it mean. We figure out where do I start and what solutions or actions can I take to address that priority problem. We actually take that action, do the thing, and then evaluate, did it help? And so then how to study? And like I said before, the answer is just practice. And so why and how do we practice for the NCLEX? And this is because practice makes perfect, right? This allows you to actually apply your knowledge from school in the same way you're going to be using it on the test. Right? So if you were a basketball player and you were trying to practice your free throws, you wouldn't go spend hours practicing dribbling up and down the court, right? You would need to practice free throws. You need to practice in the same exact way that you're going to be using the skill. And in this case, the skill is answering questions on the NCLEX. So you want your questions to look just like the NCLEX. So we've made sure of that for you here. And feel just like the NCLEX and ask about the same content. And so that familiarity is going to build your confidence, it's going to reduce your anxiety, so that by the time you actually sit down to take the test, it's going to feel like just another bootcamp practice test, right? And it's going to expose you to the high yield topics that are going to come up over and over and over. And you guys have gone through our case studies, probably saw there all the time we're using words like perfusion. We're pointing out which assessment findings or interventions are going to be related to problems of perfusion or oxygenation or airway. And so you're going to get familiar with these high yield topics and prepared for the test. And remember that every question is a learning opportunity. So whether you get it right or wrong, that rationale is there for you to understand the why. Why did I get it right or wrong? Why would this answer have been incorrect? So we encourage you to take the time to read the rationale for every item that you answer, and then you can even use our tagging system to keep track of the ones that you know you need to review a little bit more. And then it's always a good idea to be structured. So based on when your testing date is, you can follow a study schedule. And we do have 1, 2, and 3 month study schedules for you that give you day by day what questions to practice, what cheat sheets to review, when to take a readiness assessment, and how to incorporate all those pieces into your study. And then you want to track your performance over time. It's okay if you're, performing a little bit lower than everybody else, as long as you're able to see that you're consistently improving as you go. And that's the normal progression through our question bank. And then, of course, you want to prioritize high yield content, so not spending too much time on stuff that's really overly specific and is only going to help you answer a couple questions. You want to spend your time reviewing stuff that you're going to be tested on a lot. And remember that number 1 client need area is clinical judgment. So we are going to be focusing on clinical judgment today. And on the NCLEX, that is going to be in the form of the case studies. But just to save everybody some time today and prevent us from having to read through lengthy case studies, we're going to look at 6 items that test those 6 clinical judgment steps the same way that you would see them in a case study. All right, so first, recognizing cues or figuring out what's most important here. And so we've got this sample question to look at. The nurse is caring for a client with severe COPD. Which of the following findings would require immediate follow-up? And when the NCLEX asks you this, what they mean is, which one of these is an unexpected abnormal finding? Because somebody with COPD, even when they're completely stable, they're not going to have a perfectly normal assessment, right? You're going to have several abnormal findings, and you have to exercise your clinical judgment to figure out what can I just document and what do I need to act on. And so let's consider each of these. Lower extremity edema, paradoxical respirations, an increased hemoglobin level, or a pulse ox reading of 88%. Quick review of COPD. So COPD is either going to be chronic bronchitis or emphysema, and both of these will result in kind of air trapping and limited airflow. So with chronic bronchitis, smoking is going to cause chronic inflammation and mucus production and narrow the airway, so we can't get air in. And with emphysema, it damages the alveoli so that when you breathe out, this collapses in on itself and you can't get air out. And most patients with COPD have an overlap of both of these. So this is our issue with COPDs. We can't get air in and out. For lower extremity edema, why would a patient with COPD develop lower extremity edema? Do you guys remember what cardiovascular complication might happen from COPD? And there are several that might just be related to smoking, but the big one, right, is if you have too much pressure and stress in your lungs, then that's going to strain your heart and can cause heart failure, right? And so you could see some signs of heart failure. But this is describing lower extremity edema, which is basically you've got swelling in your lower extremities. What would I do about this if I was immediately going to follow up on it? I would just elevate their legs, maybe, right? It's not saying that they have pulmonary edema, that they have crackles in the lungs. It's just saying lower extremity edema. And Keep It a Secret 15 says right-sided heart failure, and you're right. So yes, that would be the right side of the heart that's strained because that's what side pumps to the lungs. So this is not a normal finding, but I don't know that I need to immediately do anything about it. The next, paradoxical respirations. Paradoxical respirations is when you normally if you don't have paradoxical respirations, you breathe in and your chest rises and you breathe out and your chest falls. When you see somebody with paradoxical respirations, that means you're seeing the opposite happening. They breathe in and their chest wall kind of sucks in, and then they breathe out and it pushes out. And so that is because they're working really, really hard to breathe. And that is a sign of impending respiratory failure. And so if you guys see paradoxical respirations in any patient, whether they have COPD, whether they have asthma, this is always a warning sign for respiratory failure, and I do not want to ignore it. So I'm thinking that's going to be my answer, but let's check the others just in case. Then an increased hemoglobin level. So do you guys remember why somebody with COPD might have an increased hemoglobin level? And it has something to do with the fact that they've got low blood oxygen. Gina said COPD patients typically have a lower oxygen saturation, and that's true. These patients are so chronically hypoxic that in an attempt to kind of get more oxygen delivered to the tissues, it thinks, oh, I just need more hemoglobin. If I just make more hemoglobin, then I can carry more oxygen to the tissues. And that's why they will have something called polycythemia vera, or they will actually have an increased hemoglobin level, and it's a compensatory mechanism. So on the NCLEX, do not be tricked. They are not going to have anemia, right? They're going to have polycythemia. So this is an expected abnormal finding, but it's also chronic, and it's not something I'm going to do anything about. So we can omit that one. And then a pulse oximetry reading 88. Gina is correct. They typically have a lower oxygen saturation, like 88%. We don't want to go overboard with oxygen on these patients. Instead, we want to titrate for a pulse oximetry to keep it above 88 to 92%. So this is a safe range. It's not something I would do anything about. So you guys are right. Most of you guessed paradoxical respirations, and that is the thing that I would immediately intervene for.